today's webinar, Dr. Kulcsar and Lindsay will explore a systematic approach to overcoming some common obstacles in home care through very innovative digital solutions.
And you need the AI and the machine learning applied to that data to let you know who's headed in the wrong direction and where might you have a false positive, and just some basic quick analysis of that data to tell you where should I be looking and first, and where do the early interventions and saves come from? Where do I need to focus first?
We've had about 200 active patients in the last 18 to 22 months, and we do average at this point close to 700 average daily census. So on every single day you log into our platform, we have about 700 patients we're actively managing. We've instituted a risk-based RPM referral tool for CHF initially. This resulted in an increase of 50% in our referrals. So we went from about 46 to about 115 referrals for just CHF in a month. Our median response time to a problem, if you look at the home health model, could be 3 days before your primary gets back to you. What do you do about that weight gain? We have about 15 to 18 minutes that an advanced provider will tell a nurse what to do, execute. And that's also because we have great clinical protocols that we follow, including oral diuretic protocols and soon to be hypertension protocols.
Skin temperature on many of these continuous or passive monitoring devices is highly flawed when temperature is such an important measure. And so this device focuses on and is able to measure core temperature. It's FDA cleared for core temperature. That's what makes this device so important and so valuable to many of these programs, but also the fact that it really is configurable. So just trying to make the best use of your time as you monitor these patients, the additional devices, the additional data, it's all good, but you've got to make it simple and efficient for your staff to respond and to know what to focus on. So risk scoring is one of those elements. We've partnered with Amazon and we're working on a care team facing chatbot to whom you could basically just write questions. This becomes your nursing assistant.
But now that we put a passive monitor on discharge on the patient and capture those first 7 days, we predict that the 26% readmission is going to go down to closer to 10%, which is what we're seeing with CHF, COPD, and some of our other high-risk cascades. And that's why we're excited about using the technology presented.
We are endeavoring to be your enterprise solution, no matter the program, no matter the patient risk or acuity, and certainly at the optimal efficiency for your staff.
It's a scale, and you're moving between different risk stages when you have patients on here. And that's also why you need a lot of tools that are monitoring tools, predictive tools, and staffing tools to be able to really manage the continuum of your patients.
We have another solution for detecting AFib, and that is in our ECG patch. That is worn on the chest. It's not only the vitals patch that's being added to our platform.
We're able to manage so much of the problems and educate patients on what to do and what resource to tap into that right now we haven't even needed to staff on the weekend to maintain these results. When you're in a patient's home and you're intimate with them daily, you know them inside out, and at bare minimum for 90 days, you're going to have a more engaged patient, a more satisfied patient. Across the board, we see better and greater satisfaction results in the RPM program than in our general ambulatory service. I'm excited to implement more of the tools presented by Lindsay. Some of them we're actually working and collaborating, and some we're on the threshold of utilizing, but the outcomes really are the clinical outcomes. What I've observed is in the beginning, skepticism, and then come 1 year into our program, I get calls from the nurse management team and population health team of, I don't know what's going on, but when you touch or your team touches our patient, our outcomes improve. Our readmission scores are affected. Our satisfaction scores are affected. That in and of itself is praise enough. You just go to bed at night happy because they could have never told you a bigger compliment than that.